Hello, we're talking to Stacy today, who's Head of Automation at Smartdesc. Stephanie's going to be talking us through a case study that's been written and about Mental Health Matters, which is a charity that Stephanie's been working with all around process automation. So over to you, Steph, if you'd like to talk us through what you've been doing.
So Mental Health Matters are a charity in the UK that specialise in mental health and social care. In one of their services, they support, they're referred via the NHS to support people with talking therapy. The manager of that service asked me what we could do in terms of automation and forms to help make that process quicker, because there were no more PWPs, no more staff that were able to take on the cases. And they still needed to provide the same quality and amount of therapy, but they wanted to work out how they could refine the process a bit. So one of the things we did was created an e-form in Microsoft Forms, and then we automated that using a product in Microsoft's Power Platform called Power Automate. And then we created a planner task for the administrators of that service that was all protected and safe. The data was all protected. And we made sure that that worked. And then we rolled that out within a week. And what that meant was we could start reducing the 2 hours of time it took to get a referred client triaged into an assessment to a shorter assessment period. So we could do that within half an hour, which resulted in there being more availability of staff to support clients in their need rather than in more detail of their assessment. So we still fully assessed them within the service, but because we were able to send them a form and ask them some things in advance of the assessment, it was less about asking the initial questions. It was more about assessing where they were as a result of those answers. So that was a really powerful piece of work, and it resulted in moving the waiting list from 11 weeks to 4.5 weeks, which was inside the NHS SLA in a really short period of time. And that's been a really positive piece of work. And as a result of that, that's become now the standard practice across all talking therapies in Mental Health Matters. We've rolled that out, and we're also building an API integration into their original system, IAPTUS, that wasn't able to support us with some of this richer functionality and turn it around as quickly as we had. And then, so we've now built it as something called a Power App, which is a bit more feature rich. And then the API integration means that there's no manual effort in any cutting and pasting whatsoever of any sets of data, which makes an enormous difference both to the admin teams, and it improves the quality of data because what the person said is exactly what's recorded in the system. There's no potential cut and paste error. So it's been a really powerful piece of work. And then one of the other things that we've been doing at Mental Health Matters is we're really conscious that when charities are funded, the funding really is about going to the frontline services. And the more we can do to refine anything in back office, anything manual, the better, because we can better support everybody that works for Mental Health Matters, particularly the frontline, and therefore better support the people that benefit from the charity. So it's been a really vital work where we've been refining back office processes, and we've mostly been using the Microsoft Power Platform. So there's a lot of Microsoft Forms, a lot of automation, a lot of task lists and subtasks. And that work has had a real impact in terms of being able to view and turn things around quick and refine a lot of the back office. We're continuing that work in hyper automation. So we've managed to both do something that has a direct impact on the front line, with thousands of people getting through the service quicker, having a shorter waiting period before they're in therapy. And we've been able to triage people who are in crisis quicker. And we've had people write in to say thank you as a result of that work. And then we've also been able to do the piece in the back office where we've refined things and made things simpler and lighter, and allowed MHM to continue taking on more services without increasing the number of people who work in the back office functions. So we're able to do more with less, which is really, really important for all charities, regardless of whether they're funded from programs of public sector work or whether they're funded by donors or both, the value, the thing that you want to help is the mission. And therefore, by being able to do more with less in your back office, then more of what you're being given or donated is directly impacting the people that you support. And that's been a really lovely thing to do in IT, because it's not necessarily how people think IT adds value. So it's been a lovely thing to be able to make a genuine impact across both of those things for a customer, and having had the freedom to say, I think we should do this, it's light and it's quick and it's relatively cheap, this is what we should do, and this is what we think the impact will be, then deliver it and then have demonstrated that value. So I think that's been really, really powerful, and establishing what we do in automation services at Smartdesc.
The value, like you say, is the impact of what you've done there, and in quite a short period of time as well, is like you say, a powerful piece of work. And reducing the waiting times from 11 and a half weeks to 4 weeks, was that, like, in a short period of time, is so powerful, and enabling the charity to carry on their vital work and reach those who need the support much quicker than they were before. And did you say that took just a few weeks to implement those changes?
So the initial change took less than a week. We did it in 4 working days. So within 4 working days, we had the new process and we were sending people the new form. And then it took a further 2 weeks to implement the Power app, which was a bit richer in functionality. And then it's taken a couple of months to get the API integration, because we've had to work with the other supplier. So it's been a gradual change, but it's been very limited change in terms of what the frontline teams had to take on, and that cognitive load for them, because we're really conscious that people on the front line supporting everyone in this mental health epidemic need as little disruption as possible. So asking them to do a vastly different thing in a different system would be quite a big ask. So instead, we didn't do that. We just changed something small in the admin teams that was relatively light touch and easy for them to adopt. And then all of a sudden, the data turned up in the place they wanted it. So we're really conscious, mindful that the frontline teams are the most vital asset in helping us get through this mental health epidemic. So that's been a really useful piece of the work. And yeah, we went from 11 weeks to 4.5 weeks in quite a short period of time, literally just as we were churning through, getting people through that waiting list and getting them into therapy. And the demand there was just on therapists' time, and that's why it wasn't instantaneous. We could turn it around because we still had to work through the waiting list sequentially.
Incredible. So that's such small changes, but such valuable work. And I think sometimes, like as you mentioned, the value of IT, people don't always see that the actual changes that's making, and in this case, it's actually saving lives.
I think the hyper-automation piece is so valuable, and utilising the tools that haven't been around. So robotic process automation has probably been around for about 30 years, but generally available robotic process automation, so like picking up Power Automate and Power Apps, has been around for 2 years. And that, picking that up and running with it, really has the ability to transform how a charity operates. And we see a lot of charities that have dual keying, triple keying as a standard process, printing things out, typing them in. And it was only in the pandemic that a lot of charities sat up and realised that they should be doing more, or wanted to do more, or started hearing the words digital transformation. Before that, it was very much public and private sector were doing it, but smaller charities couldn't afford to get into that game because RPA was an expensive thing to be making. It becomes a lot more easy to step in and make a change just to a process. And whether that's starters, levers and movers processes that HR deal with, whether that's volunteer management, or whether that's something on your front line, or whether that's another back office process, processing expenses, things like that. All of those things become a viable thing you could just fix by itself without having to buy a huge system and then customize the huge system, which can be overtly expensive for charities, particularly the smaller charities, that's just not, there's no starting point for them. Whereas I believe that Power Platform from Microsoft with Microsoft discounts is such an easy way to step into this in a really affordable way. And you can, within 1 to 3 months, have had a return on your investment in terms of the amount of hours it takes for doing the process the old manual way versus doing the process utilizing automation within Microsoft 365 and Power Platform. And I don't think people have realized quite how easy it is to pick up just some processes and do something. And then once you've embedded that change, to implement on top of it, rather than feeling like you have to do the whole move everything to the cloud and then move all of the systems, buy new systems, move everything, and then do this later. I think now you have the ability to just pick up and do one process or two processes and get that immediate benefit.
So small changes then, and as you said, affordable and easy to implement if we're taking sort of piece by piece rather than trying to reinvent the whole system at the same time. So that's incredible work. And if anyone wants to find out more from you, is it best that we ask people to contact solutions@smartdesk.co.uk? And are you happy to have a chat with any charities? I know that you are speaking to quite a few charities, aren't you, about process automation?
Yeah, we offer a 45-minute session to any charity free of charge for a consultation. So we do that in automation services as well as any of the other offerings that we have. And then with the charities that we currently work with, we also will happily have a conversation about where they are, what they aspire to, what some of the things that they're conscious of that they'd like to fix, or the things that are noisy and frustrating. So we can take a look at that, or give them an overview of things we've done, how we've used the Power Platform before, and what we see as some of the opportunities for them. So it's completely up to the charity as to how that conversation goes and what the key things they're interested in are. But yeah, we're more than happy to have conversations and understand where they are and how to step into doing some change work.
That's brilliant. Thanks very much for your time, Steph, today. It's fascinating, and look forward to seeing more of the process automation